Hello friends, today we are going to operate this case of hemorrhoids. This is a case of 3rd 4th grade hemorrhoids. Patient is male, 65 years age. We have already given pudendal block, local anesthesia in this case, and now we are ligating it. Ali's forceps have been applied at 7 o'clock position, and we have holded this 7 o'clock pile mass by using Piles clamps, and we will ligate it now. The pedicle at its base will be transfixed at base and will be ligated. We have used 30 linen thread here, and this is transfixation of pile mass at 7 o'clock position. And we will ligate it. First knot will be placed medially. This is first knot we are placing at the point of transfixation. We have ligated this pile mass. This transfixation will cover blood vessels, hemorrhoidal artery as well as vein, and we have to strangulate this pile mass through this ligation. This first knot has been placed medially and this knot has been secured. Now second knot will be placed, but before that we shall separate the mucosa from skin, and I have used cautery for this purpose, and I had not used cut mode. I have used cog mode of cautery. Then I will place my second knot laterally by making this groove. If we don't make this groove, it takes much more time to shed off these pile mass. Now lateral knot has been placed. Now one or two more knots I will place to secure it properly. Now by the same thread I will do another fixation of the pile mass at 11 o'clock position. For this I will put this remaining thread again in needle and then will transfix this pile mass at 11 o'clock. See, I have put the thread inside the needle, holded it through needle holder, removed the clamp from 7, and clamp has been applied at 11 o'clock pile mass. Now again pedicle is transfixed at base, and again knot is placed at medially. The same steps have been repeated to ligate the pile mass at 11 o'clock position. We can take separate thread too, but in this particular case I have chosen the same thread and transfixed it. Now medial knot has been placed for 11 o'clock position pile mass. Again I will use cautery to separate the mucosa from skin. and thereafter I will place lateral knot after separating mucosa from skin properly. Now again I have used this cautery to separate it, to separate the pile mass mucosa from skin. Then we'll ligate it. In this way, through a single thread, we have ligated two pile masses. One is at 7 o'clock position and another is at 11 o'clock position. And finally it's done. Now we shall proceed for the pile mass at 3 o'clock position. After mopping, I will apply Alice forceps at mucocutaneous junction at 3 o'clock position. Then I will hold the pile mass at 3 o'clock position through Piles clamps. Application of Alice forceps, and then holding of pile mass at 3 o'clock position. This pile mass will also be transfixed and ligated in the same way as we have done for 7 o'clock position and 11 o'clock position. This is being transfixed. The pedicle is being transfixed at base and this will be ligated. First knot will be placed medially and after that we shall place other knots to secure it, to ligate it properly, to strangulate it completely. This first knot is medial. Securing this knot. Now we'll separate this mucosa from skin at mucocutaneous junction using cautery. Then again the medial knot will be placed inside this groove which we have just created using cautery. After ligating this hemorrhoid, we shall ensure that if there is any oozing or bleeding, then that will be addressed, and finally dressing will be done after this. In this way we shall conclude this procedure. The entire surgery almost took 15 to 20 minutes to ligate all the three pile masses completely. and after that we shall do paschat karma, that will include daily sitz bath and matravasti of jatyadi tel, that will shed off all these hemorrhoids without further any complication, and finally patient will be completely cured, get rid of these hemorrhoids in about 2 to 3 weeks completely.